Hair transplant surgery steps. You are planning a hair transplant for yourself or your family or friend, but you still do not know what will be the steps in the process of hair transplant, what will be the pre-requirements during the procedure and after hair transplant. So from initial to final, what will be the journey of your hair transplant process? In order to discuss this with you, today I am here. My name is Dr. Preeti Saraswat. I'm American Board Certified Hair Transplant Surgeon, and in this video today, let us discuss all the steps of hair transplant surgery. In order to gain more information about such procedures and testimonials of patients, subscribe to my channel, Saraswat Hospital. So step number 1, when you come for consultation with your hair doctor, the first thing which should be done should be dermoscopy, or more precisely trichoscopy. Derma means skin, scopy means to see with an instrument. To see skin with scopy is dermoscopy, but to see specifically hair, it is trichoscopy. So when we do trichoscopy of your scalp, and in that we do for the recipient side as well as the donor side. The donor side could be scalp or it could be body part in a few cases. Then in those cases, the trichoscopy should be done for all the donor areas. So trichoscopy, let me discuss in a few lines what it will do, how is it helpful to you. It will tell us the quality of hair at your donor site. Not only the quality, but also how many hairs you have. Whether you have more of 2-haired grafts, 3-haired grafts, or 4-haired robust grafts, or you have single-haired more. Then again, what is the diameter of individual hairs at the back? So are they terminal hairs, which are more than 0.06 millimeters, or they are intermediate, which is 0.03 to 0.05, or they are vellus, which are downy hairs less than 0.03 millimeters, and what is the ratio between thick and thin hairs. So explaining in a little more detail, the ratio of thick hairs to thin hairs, that is terminal to vellus or terminal to intermediate, is very important once we are discussing the possibility of hair transplant. So if you have better ratio, then the possibility is better. You will have good results. But if you have more thin hair and the ratio is more of thinner vellus hairs, then maybe the doctor may suggest you that hair transplant is not for you, or otherwise they may always tell you which step would be better for you in the procedure, what steps should be taken by you after the procedure, and also this will help you in long-term planning and treatment of your hair, because your hair transplant in the first session or in the subsequent sessions or the medical therapy, everything will depend upon the trichoscopy report when you undergo a trichoscopy. Also, when we see the scalp, we will be able to find out if there is any disease on the scalp. If you are suffering from any disorder which may be there suspected, then we may go for a biopsy, or we may suggest some other tests for you to undergo before you actually go for hair transplant. So you see, the planning is more important, if not as important as the procedure itself, because then we would be clear whether you will have good result or the result would be compromised, as the case may be. We also take the measurements of your donor area at the back, the width and the length of it, and we calculate the area and we find out how many grafts we can take out. And also at the recipient side, we measure the area, how much is to be grafted upon, and accordingly, according to the density required, we calculate the total number of grafts required. So it's very clear now, the grafts required, the grafts which you have, and then accordingly whether you need any other donor site or not. Apart from this, we also make you undergo the various investigations, which include the mainly blood investigations, so that we know that you are physically fit to undergo this surgery, and also other things like ECG to find out rare causes also of any heart problem like Brugada syndrome. Then we find out the sensitivity for you, whether you are hypersensitive or allergic to different medications which we would be using at the time of your surgery. So the local anesthesia, the antibiotic, they have to be sensitivity checked before we actually give you, and also any other investigation required as per your physique, we make you do it so that there is no safety risk while we carry out the procedure. Because being a cosmetic procedure, even otherwise, your safety should be number one. Since the procedure, when it is undertaken, you should be safe and you should be happy after the procedure. If you want to ask anything, about the treatment planning till now, you can ask in the comment section below. Do take out a moment of yours and hit the like button. At the time of consultation only, we take your vitals, your blood pressure, your pulse, then your history of present illness, chief complaints, then history of past illness if any, your history of any medication, allergies, social history which includes history of alcoholism or tobacco or any other drugs, then family history, medical history about the family, and a very important, whether this hair loss is hereditary in your family or not. This consultation is then finished, and after we do all the other required things about you, we see your reports, the investigations, all the ECG and everything, then we decide a operation date for you, hair transplant surgery date. And when you come on that date in the morning itself, we ask you to come with a good breakfast, with a heavy breakfast. After you arrive, we again check your vitals. We ask you about medication if you have taken any, especially the ones which we had suggested. Then we ask you about how are you feeling. You should be feeling fine. You must be hydrated. After that, we draw a hairline for you. Before also we draw it at the time of consultation when we are consulting. But today it is a final hairline. After we agree to the final hairline, we then take you to the OT table so that we start the procedure. If you have any questions in the steps till now, or you want to get a consultation done for you or your family, you can call us on the numbers below so that we can connect. When we start your procedure, we give you a local anesthesia on your scalp in a ring shape so that inside the circle covering the recipient as well as donor area, the whole of the area is anesthetized in one go. And when we are doing it, we do with a very fine 32 gauge needle along with the vibration device, so that taking advantage of the pain gate theory, the brain thinks that we are still giving vibration while we anesthetize you, and at the same time, so that you feel pain less than you must have felt if there was no vibration. So after we give the local anesthesia in the deep plane, we again give on the superficial plane in the anterior part so that there is no pain at all. After this, if you have any query in your mind and you want to see the journey of any hair transplant patient, click on the video on the icon so that you are able to see that. Let us discuss now how we make slits on the scalp. These are the pre-made slits. So why pre-made? Because we'll be putting the grafts in them later on. In the front and mid scalp, if you see your natural hairs, they grow forwards, but they grow at a particular angle, direction, and there is a particular density to them. So while we are making the slits, we take care of those angles, direction, and density. So usually it is in the sagittal plane, like it is anterior-posterior, from front to back. When we do this procedure in the crown, we have to follow the whirl pattern. So you see, instead of the hair coming at this angle, it follows a whirl pattern. And so the hair, they come at an angle to the scalp as per the whirl there. So the various devices which we use for making the slits, they follow that pattern only. Whirl pattern at the crown, anterior posterior, front to back in the front and midsection. The various devices which can be used are, this is a sapphire blade. This can be used for making slits. It's very precise and we can make dense slits with it. And apart from this, here we have a CTS blade. Again, it's very precise and we can make very good slits with it. Some doctors also use a needle for slit making so that there is a round shape. They have various pros and cons, but usually they are used and they give good results. Of the various instruments we just saw, the sapphire blade is the latest, and because of the thinness of the blade, we can make more slits with this in the same centimeter square area than the CTS blade or the needle. So we choose from amongst these which is in the best interest of the patient. The rest of the parts of hair transplant journey will be covered, discussed in the next video. So stay tuned for that. Also share this video with your family and friends who are planning to get a hair transplant done. To know about difference of quality between cheap and expensive hair transplant, click the video on the left. And to see the next video of this series, Steps of Hair Transplant, click the video on the right.